So, our today's topic is robotics and automation in clinical care. If we had talked about it nearly 10 years ago, it would have been sounded as if we are talking about some sci-fi film, right? But for today it is not anything new. So everyone is aware what are robots and how the automated things are we are inculcating in nowadays healthcare section also is a technology which is run by software or a task or checklist in a way which is given to feed it in a system or a robot so that there is a minimal involvement of human. Okay, so robots and automation usually refer to the use of intelligent machines. As we say, computer systems are there, automated processes like AI system are there, much similar to like what we use of daily basis of alarm and all that are used to perform the task. So the role of robots is to improve the task capability, to improve the efficiency, the consistency towards the healthcare delivery. We are nowadays using it for surgeries. We will surely discuss all these things in complete detail one by one. So, diagnostic, rehabilitation, even patient monitoring. And nowadays, I have not declared it here, but even patient diagnosis is also is in a trial where robots are helping us. So, what does this helps? How does this robotic system is going to help in healthcare? It reduces the human error. Usually in healthcare system when we are talking, we majorly talk about the human error which occurs during the clinical care which we provide to the patients. So when it comes to the robot, it always acts completely towards whatever is being system is being fed to it. So it helps in reducing the human error. In another way, we everyone knows if a machine is acting or working, so it reduces much of our manpower work also. So whenever we are facing to the staff shortages or the increasing of the patient load or any some complex treatment which requires a lot of cross checking with books, and sometimes even the highest biggest doctor also needs to go through back to his books and notes in some complex types of treatment. So that has been decreased with help of such technologies. Anything? Okay. So how it has been evolved in healthcare? The evolution we find has started from the basic stage towards now a complete AI intelligence. So we can see that it in a three factor. I had divided it in few factors and bullet points so that it is much easier to understand and much easier to inculcate that in your daily work and daily care towards the patient. So earlier it was a manual system which many of the hospitals are still following, but we find majorly many of the corporate hospitals are completely on the phase towards they are going for a digital system. So how they are going digital, they are moving out all the paper based work or the processes and their SOPs policies in a very digitalized way so that easily the things can be checked out. The electronic health records which we called as the patient record, earlier it was in the files where it was requiring lot of storage, sharing places, time to search out the files, mishap of the files, sometimes many errors which are happening, the paper misplacement. This all has been reduced due to digital tools which are keeping the complete patient record in the system. The automation has also reduced these errors which I am talking about, where the manpower and the overall workflow which happens ki, many a time we also have faced out ki how file has been misplaced, it was been kept here, it was been there, or the paper has gone away. So these all errors are completely reduced due to digitalization. Now this digitalization has transferred our a normal hospital to a smart hospital. We all are aware how no, none of us want now a normal Nokia mobile, right? Everyone wants a smartphone. Even the new birth or even a preschooler also is interested to have a smartphone. So similarly, every patient choice is towards going to a smart hospital. So what is a smart hospital in base? Smart hospital is a hospital which has all the advanced technologies, every connected devices, and has all proper automation, because even the patient gets a feeling of safe hands or timely treatment, good efficiency, and in a way they can have a proper record, they can have the automated results about it, they can keep a data tracking of whatever has been treatment has been done, and the decision making also helps them to a lot. Okay, so it is a win-win situation for both the patient and the hospitals. So I will tell this in Hindi at the end of the third factor. Then the third factor is the integration with the AI. Now, how, if AI is helping out in many other systems, then why not healthcare? So that is why the AI has been analyzed in the healthcare, that has been helping with the diagnostic and the treatment planning for the patient. Many a times, non-complicated treatments which are going through a very standard way can be easily fed up to, with the computers, and the diagnosis or the prescription can be run out at the view just in a wink of आई. सो देन अभी ये हम जो बार बार रोबोट्स रोबोट्स बात कर रहे हैं, तो ये रोबोट्स होते क्या है? तो ये अलग अलग टाइप के रोबोट्स हम यूज, अभी ऐसा तो नहीं रहता है कि हमने एक पर्सन ले लिया और वो सारे काम कर देगा, ह्यूमन नहीं होगा कि उसको डिफरेंट, तो हम स्पेसिफिक रोबोट्स यूज करते हैं हेल्थ केयर इंडस्ट्री में। अगर सर्जरी करनी है तो स्पेसिफिक वहां पे सर्जिकल रोबोट्स रहते हैं। हम आपको एक पिक्चर एक मिनट शेयर करते हैं। ये होता है सर्जिकल रोबोट, इसको आर्म्स रहते हैं, ये 4 to 5 आर्म्स रहते हैं, और इसका सारा कंट्रोल यहाँ पे बैठ के डॉक्टर करते हैं। तो ही जैसे हमारा गेम्स का पैडल रहता है, कीज रहते हैं, उसी तरह ये यहाँ पे इससे डॉक्टर्स उसको वाइंड अप करते हैं, एंड द पेशेंट एंड द नर्स। तो इससे क्या हमको यहीं के यहीं पता चल रहा है कि हमको कम कम से कम मैन पावर लग रहा है, और बहुत ज्यादा भीड़ नहीं है, तो इन्फेक्शन भी नहीं होता है। तो ये बहुत सारी चीजें हैं जो ऑटोमेशन की वजह से काम आएगी। सो सर्जिकल रोबोट्स हमको पूरी तरह एक इन्वेसिव जो भी प्रोसीजर रहता है वो मिनिमल हैंडलिंग से प्रॉपरली हो जाता है, और इंसिशन स्मॉलर रहते हैं, ब्लड लॉस कम होता है, पेन कम, अभी ये सारी चीजें कम होगी तो पेन भी कम होगा और पेशेंट जल्दी भी ठीक होगा। तो जितना भी लैप्रोस्कोपिक है, ऑर्थोपेडिक है, या कोई भी न्यूरो सर्जरीज है, ये सारा सब कुछ हम 3D बेसिस पे पूरे 3D विजुअलाइजेशंस में ये सारे सर्जरीज इजीली रिकॉर्ड कर सकते हैं जो सर्जिकल रोबोट्स करते हैं। तो बस ये किया जाता है, बट इसका मतलब ये नहीं है कि हमको अभी डॉक्टर्स की जरूरत नहीं है। आप देखो, आपने पिक में भी देखा कि रोबोट भले काम करे बट फिर भी उसको हैंडल करने वाला हमारे सर्जन होता है। डिसीजन मेकिंग जो रहता है फाइनल, वो डॉक्टर का रहता है। ही इज द पर्सन हु इज गाइडिंग, बट इतना ही है कि वहां पे 10-12 लोगों के बदले वहां पे एक इंसान से काम होता है, वो परफेक्शन से होता है, मिनिमम ब्लड लॉस होता है। देन थर्ड कम्स द सर्विस एंड नर्सिंग रोबोट। फैक्ट है कि जो सर्विस एंड नर्सिंग रोबोट्स आर ऑल्सो बीन प्लेस देयर, बट वो पूरी तरह नर्स को रिप्लेस नहीं कर सकते। इट इज ऑफ कोर्स, रोबोट्स आर जस्ट फॉर हेल्प, टू सपोर्ट आउट द टास्क, नॉट एज अ कंप्लीट वन। सो वो असिस्ट करते हैं उन सारे रूटीन प्रोसीजर्स के लिए, जैसे पेशेंट का मेडिकेशन देना है, पेशेंट को एक जगह से उठा के दूसरी जगह रखना है, पेशेंट का वाइटल साइंस मॉनिटरिंग करना है, जो हम लोग अभी ऑटोमेटेड मशीन से पेशेंट्स के बीपी, टेम्परेचर वगैरह सब कुछ जो हम लोग मॉनिटर से कनेक्ट करते हैं। मॉनिटर भी एक तरह से हमको ये ऑटोमेटेड सिस्टम ही है जो हम ऑलरेडी है, बट तो हमको ये हम अभी उसको टर्मिनोलॉजी दे रहे हैं कि दे आर द हेल्थ असिस्टेंट्स टुवर्ड्स द नर्सेस। सो इन अ वे दिस आर द सर्विस रोबोट्स। पेशेंट्स को एक जगह से मूव करके दूसरी जगह रखना एक सिस्टर का हाँ पॉसिबल नहीं होता। तब हमको अगर क्रिटिकल पेशेंट होता है या हेवी लिफ्टिंग पेशेंट होता है तो हमको 7-8 जन लगते हैं, बट वहीं पर अगर हम एक लिफ्टर रोबोट अगर यूज करते हैं तो वो एक सिंगल person can handle the machine and move the patient from one side to another with a proper care. सो दिस इज द सर्जिकल रोबोट. तो अब इस सर्जिकल रोबोट में आप देखोगे कि ये ओटी पूरा या ओटी सर्जन कंसोल में रहेगा. ये रोबोटिक आर्म्स है. अगर आई एम एक्सप्लेनिंग अगेन, दिस आर द नीडल्स और द आर्म्स विच आर हैविंग प्रिसीजन इंस्ट्रूमेंट्स. एंड ये बहुत मिनिमली, बहुत कम वक्त में, बहुत माइन्यूटली सारे सर्जरी की जाती है और पेशेंट को हील जल्दी होता है. Okay, now, so let's talk about. I let's have a interactive session on this. कि सर्जिकल रोबोट्स में बताओ मुझे क्या आपको समझ में आया. एनीवन? लेट्स हैव अ इंटरैक्टिव सेशन. स्टूडेंट्स, आप हिंदी में भी बात कर सकते हो, कोई दिक्कत नहीं है. लेट्स डिस्कस ऑन दिस पॉइंट्स कि कौन से रोबोट से हमको क्या फायदा मिलता है, क्या उसकी कमियां हो सकती है. अब हर चीज में जितना कुछ पॉजिटिव होता है तो उसके कुछ नेगेटिव फैक्टर्स भी होते हैं. एनीवन?
हेलो मैम, गुड इवनिंग।
गुड इवनिंग मोना.
मैम, मुझे एक डाउट था, ये जो नर्सिंग का जो ये इसमें वो है, क्या कहते हैं?
हम वन बाय वन जाएंगे. अभी हम सर्जिकल की बात कर रहे हैं. हम ये सारा डिटेल में वन बाय वन करेंगे.
ओके मैम, ठीक है।
तो ये सर्जिकल रोबोट के बारे में, इसका एक्यूरेसी एक्सट्रीमली एक्यूरेट रहता है. क्योंकि अगर तुम रोबोट को बोलोगे कि मुझे 2.3 सेंटीमीटर का ही स्लिट चाहिए, तो वो एक्यूरेट 2.3 का ही बनाएगा. वो 2.31 को भी नहीं जाएगा. तो ये एक्यूरेसी रहती है रोबोट्स की. और उनका मूवमेंट्स बहुत स्टेबल रहता है. मतलब ह्यूमन की तरह समझो, हाँ धक्का लग गया या ट्रेम्बल हो गया या कुछ हो गया, थकावट की वजह से एनर्जी कम हो गई, ये सारी चीजें रोबोट में नहीं होती है. तो वो एक्सट्रीमली स्टेबल रहता है. जो इंस्ट्रूमेंट हैंडल करने का रहता है उनका बहुत फाइन कंट्रोल रहता है. हम लोग कभी कभी देखते हैं, जो जिन्होंने ओटी में काम किया होगा उनको ध्यान में आता है कि किसी ना किसी कारण से इंस्ट्रूमेंट हाथ से गिर जाता है, वेस्ट होता है. फिर उतने में ही अगर कोई और नहीं, बैकअप नहीं रहता है, तो भागो भागो जाओ, उसको सीएसएसडी में लेके जाओ, उसको वापस ये करके लेके आओ. सो दिस ऑल जो ये मिसहैप होता है वो रोबोट्स में नहीं हो जाता होता है. देन जो एक्यूरेसी और जो कॉन्फिडेंस रहता है, रोबोट्स मशीन है, आप उसको जो बोलेंगे वो उतना ही करेगा. तो उसको कॉन्फिडेंस, डर या पैनिक, ये सारी चीजें उसमें आती ही नहीं है. और जो भी वो करता है रोबोट, उसका एक 3D विजुअलाइजेशन मिलता है. जब डॉक्टर्स या सर्जन परफॉर्म करता रहता है, तो बहुत सारे लोग नहीं देख पाते कि एक्चुअली उस ऑर्गन के साथ क्या हो रहा है, राइट. उसके लिए कैमरा लगता है. बट जब रोबोट काम करता रहता है तो उसका एक पूरा 3D विजुअलाइजेशन मिलता है. मिनिमल कट रहता है, अननेसेसरी कट्स नहीं रहते हैं, टिश्यू का डैमेजिंग कम रहता है. देन अब ये सारी चीजें अगर कम होती है तो उसका ही पेशेंट का हीलिंग भी फास्टर होता है और हॉस्पिटल का स्टे कम हो जाता है, जिसकी वजह से पेशेंट को भी कॉस्ट भी कम लगती है. तो एंड इवन कोई और 10 लोग नहीं है तो ओटी में इन्फेक्शन रेट भी कम हो गया, ब्लीडिंग भी कम हो गई, सर्जिकल एरर भी कम हो गए. तो मीन्स इट इज अ विन विन सिचुएशन फॉर द हॉस्पिटल ऑल्सो, कि जहाँ पे क्वालिटी का इंडिकेटर अच्छा हो जाता है. So again I will highlight it out. So surgical robots helps to do everything in a very extremely accurate way. They don't have any issues of hand tremors or getting any mishap due to unstable movements. Okay, so they have a very fine and a good control on the instruments which they are handling. They are very well fitted about how the procedures has to be delicately handled out. And whatever the visualization, when a human does or when a human surgeon does the surgery, the visualization is very minimum. Even if they use a camera, it is very minimum. But in case of a robot, it is a complete 3D visualization. The invasive procedures, if you ask the robot, if you feed the system that they have to cut for only 3.1 centimeter, it will cut only to 3.1 centimeter, not even a millimeter beyond that. So this perfection gives very less of tissue damage, very less of blood loss, and hence overall giving a very quicker patient recovery and otherwise towards the shorter hospital stay. So this is a win-win situation for both the hospital and the patients. So above all, overall as a 360-degree, we can say that due to all these factors, the infection rate goes down. There are less of surgical errors. So this gives a very healthy situation where the hospital is at gain, having a good quality control and a good infection control. So, talking about patient robots in nursing care, I think I will take the doubt of Miss Mona. Miss Mona, you had some doubt. Can we have your doubt so that I can start explaining on the same?
मैम नर्सिंग केयर का क्या रोल है इसमें, मतलब कि जैसे रोबोटिक इसमें।
Okay. So, as we had discussed, कि nursing care, robots cannot completely replace the nurses, but yes, of course, they can help it out in a assisting manner. Where, for example, when we talk about medication delivery, the robots can transfer and deliver the medication safely to the patients. If at all the nurses feed out, कि this is the medication which the patient has to be given. So, what it will, our syringe pump in a way it is also a type of robot, yes or no? You are
Yes, ma'am.
feeding the details in that. So that is how previous we it is not that robots are always a man looking like machine which will come and help you out. Everything, every type of machine which is helping you out in a feeded data manner is a robot. It is a automated system. So machines like our ventilators, our syringe pumps, our monitor, they are all a part of robots. They can be fed out with AI, where they can be fed out कि this is the medicine which has to be given in this much time. So what happens, it reduces the errors. It gives a very timely administration. Even if the nurse is busy with many other course, the robots or these machines do their part. For example, if for the previous time, if the doctor used to guide, he give DNS for DNS 500 ml for 5 hours. Are we able to give it correctly to 5 hours? No. Sometimes the fluid used to run for in 4 hours. Sometimes it used to go for 6 hours. Yes or no? Yes, even now today we are not able to completely do it out, even if we do it out with a drop rate factor, everything. But when you put it in a syringe pump, it gives inaccurate 5 hours. So this is how the robots are helping the nurses. Earlier in ICUs itself, majorly in ICUs, the nurses used to be having a very high time during the sponge bath. They used to need at least two or three people to move out the patient from one side to another, to roll the patient, to transfer the patient from one bed to another, or transfer from bed to the wheelchairs. So this is how it reduces the patient mobility issues, and the safety measures have been taken because the robots take all the needful care and avoids the fall risk scale also. The elderly patient, the post surgery patient usually are being very handedly given a physical assistance without any error. The third part which the robots or the automated system is helping out is the vital signs monitoring. The vital signs, like we have monitoring tools, the sensors, the blood pressure, the oxygen level, the monitors, they are doing a continuous real time data towards the nurses. So they don't have to be continuously depending on a manual check of the patient, except it is some issue. So this gives a early warning signs, many early warning signs which the nurses manually is very tough, but due to all this automated system it helps out to detect the complication in a timely way, so the doing all the interaction. Any doubts on this slide?
No, ma'am.
So now, as in the start, I told you that the most critical phase where we feel it is not safer, even that is under trial, that is the doing the diagnosis of the patient. Automatic diagnostic. Yes, of course, you might have read in the news and the newspaper. AIMS, just 1 or 2 months back, there was some error in the X-ray report of big hospital. So the thing is that the things are being feeded up. So error can occur in 1 in 1,000. But of course, what about the other 999? They are perfect to the point, and that so human it is equally comparative to the humans, but these robots are doing much more easier task towards the staff also and to the patient, because it reduces the time, it reduces the sampling handling, it gives a perfection to the test analysis. So this overall gives a thorough output, reducing the human errors. The labs are having much more brighter technologies which are giving the results out in wink of time. So this helps a timely treatment toward the patient. They don't have to wait for the results for the end of the day or to the next day, and these results are completely consistent and standardized way it has been done. Similarly, what we are talking about, the X-rays, CT scans, MRI, and the ultrasound images. Previously, we used to only get the films and the report. The radiologist used to go through the film, make the report, and we used to get the reports after 2 to 3 days, and that used to prolong the treatment time also. But nowadays, with the help of AI, we are able to get the reports in just a few seconds. So these all have a rehabilitation can be easily done with the help of these robots. So these robots help them with all the movements and a very proper systematic way the rehabilitation has been done. Similar way when it comes to the orthopedic recovery, the joint replacements, the fractures, the musculoskeletal surgeries, which are to be carried out in a very safe guided way, in which many a times even the mobility causes problem when we are handling it as a human. So that has also been handled in a very smooth way by a robot, and this helps in reducing the therapy time and a risk of a re-injury. But in all this, in overall in all this, there are sometimes, as we say, that not all cases are the same. So similar way, somewhere we require a customized therapy which is based on individual patient needs. So in such case also the robots are the best thing we can rely on, where you can give a real time feedback about the patient or the therapy to be carried out, and the robot will handle it out in a very smoother way, giving all the motivation and the effectiveness to the process. Any doubt about this?
No, ma'am.
So now, when we had talked about the robots are replacing the surgeon, the robots are helping in our labs, the rehabilitation, the nursing staff. So why not our data? So similarly, you can see that many of these things are not new to you people, but only the thing is that the progress is happening so fast that we don't realize that we are going in a so automated and in a technical way in the healthcare system also. So what are the systems which we usually see is that electronic health record. So electronic health record, as I in this very start we discussed out, there were files, there were records, the treatment, there used to be error while writing the reports, there used to be error while putting paper files, ki ye paper, wrong files, wrong paper, wrong placement. Sometimes the file used to get missed out. So in case of electronic health record, it doesn't happen. It is a proper digital record, and the patient medical history, his results, his treatment file, plans, his follow up, is everything is fed in the system, and it is such a speeder that with the unique IDs, so that even with a wink of eye, any doctor, nurse, or any specialist can move to it. So this overall handles out as a data accuracy and a continuity of care, which helps in a proper, faster decision making to the patient. Now, another issue which we had been seeing, which used to consume a lot of time, is the appointments, shifting of the payer staff, and then OT allocations. They used to be having mishap. Ki same time was given by somebody else, or many appointments in the same time. There was no proper roles which was happening. Ki who is coming at what time, which OT is free, what time the OT is free, how this time management has to be done. So these all scheduling also the systems, the software are handling in a way, and this reduces the waiting time and the administrative workload, because now every patient is aware ki their appointment is at so and so time, or even the staff don't have much hassle. Yes, the operating room is busy for this hour and this hour it is free. So this all increases our efficiency as a operational system to the hospital. Anyone has seen the shoots in the hospital? Do your hospital have a shoot system?
Yes,
Yes,
ma'am.
Vijay?
ma'am.
Yeah.
Yes.
Oh, yeah. So that is also a type of robotic system where the medicines or the samples or anything which has to be transferred from
Testing.
one end to the another end in a wink of eye is been done by the shoot system. So that is also a type of technology
Technology.
improvement in our clinical care. Then comes the supply chain automation, like inventory management, the procurement, the distributions. Now, when we talk about the as in our, we feel as a nurses, we feel there is so much for us. Similarly, even the other procurement supply chain also has many things to be done. The inventory management of overall the hospital is not a easy task. So even automation of all these things helps to get timely all medications and the equipments consumables. So what happens due to all this perfection, we don't have a waste or the shortage of anything. There is no delay at all, because with just a click of movement, with we get all the data ki how many injections you want, or which injections are near expiry, everything is in the data. So this overall improves the operational movements. Any doubt about the clinical workflow?
No, ma'am.
Since the start, we are talking about the robot is going to this, robot is doing that, and we are talking this for the patient. So let's understand how it is going to benefit the patient. So, as we said in between, that this is helping out in the safety. How safety? Because it is reducing the human errors. When even if it is in a surgery or in a medication delivery or the monitoring or even the rehabilitation, so we see that if the human error is been reduced, of course the patient is in a more safer hand. Then if you are keeping the monitoring in a continuous way, which is precise, so it prevents any complication or accident. Sometimes means the if the automated system is being feed that if at all the bp is being shooted from this level, give a beep. So when you get a beep, you immediately know that the patient needs a high care to be taken of. So this is the way it helps in reducing the accidents or any complications. Overall, reducing the infection control, our bad outcomes in a way that can be prevented by reducing the unnecessary human contacts and giving out a good quality results towards the patient care. And the when we were talking about diagnosis, if at all as we saw said 999 diagnosis having a perfection which gives a very clear treatment is no loss. So this overall increases and improves the surgical success rates, the therapy effectiveness, and the patient care quality is highly improved. This help overall in a way the patient now, if anyone where earlier the for even for a smallest surgery, the patients used to be required to stay in the hospital for at least minimum 3 to 5 days. Nowadays, many of the surgeries can be done in 24 hours. The patient can go home. Why it is? Because of the precise surgical way which has been done with the help of robots. And this in all gives a very faster recovery and a reduce of the pain, reduce of the hospital stay. So overall help, even financially they are being supported well, so even the patients are very happy about it. So that's the independence in a way towards the patient for a pain free and a safe surgeries or a treatment. Anyone wants to add anything on, or anyone who has any doubt about this patient's benefits to patients?
No, ma'am. It's clear, ma'am.
So now you say कि customers is being done care. You had talked about hospitals, but what our healthcare staff? So we all know the most important thing what the healthcare staff is being nowadays suffering is the workload. Less of staff members and lot of work. So if you have some automated system in your hand, if you have the data, if you ask the previous nurses, they used to have to write out many forms which they need to do it out. Nowadays you don't require, you just have to tick in the tab and the thing is being reduced. You have proper templates which can be easily cut and paste there, and your nurses notes are also done. So this helps in your reducing your time consuming task. Your daily routine repetitive task also can be done with the help of the AI system or the robots. And if your task and you are able to give your time towards a more clinical or the critical task which are required for the patient can be easily done by the nurses, when this unnecessary the task which can be done by the I can say which can be easily done by an assistant are being handled by the robot. So manual documentation, supplying or looking out for the inventories, the monitoring is all taken care by that. And when once if you are at peace at your work, if you are not burned out, then of course your efficiency as a healthcare is also increasing. So you are able to streamline rest other things and doing it out in a very speeder and accurate way. So this overall gives an optimized resource utilization and patient flow. Okay, now in between somewhere I had mentioned out that everything has a negative or small negative side also. Everything cannot be positive. So there, as we have challenges in human work, even the challenges we do have in robots also. So now what are these challenges? The first challenge is the high cost. Robots do not come at low cost, right? They do. They are replacing many 10 peoples. They are replacing, reducing the, cutting the time to the lowest. So of course they are going to come at the cost. So the investment is expensive. The maintenance of it, the software update, the time to time the software has to be updated. It has to be improved out in an operational way, and this all is not affordable to everyone. So only we can find these smart hospitals towards only a bigger corporate level. So we find it in a very big cities, etc. Now, when we say robots, so who is going to handle? They are not going to work on their own, right? Someone has to work on that. So that again demands for the training need. So whoever staffs are there, they have to be given a specialized training to operate this robot. Now, another way, as I said, technical dependency is going to be there. Of course, it is a technical thing. So once it is a machine, you might have any disruption there. There might be situation where there can be a system failure. So relying completely on your machines is also a big challenge. So and even also as we are talking about key data are kept in all this system, and everything is at a wink of eye, or you just a single tap and you get all the data. So there can be issues towards the patient information safety or a data safety, which can create a cyber security issue. Okay, am I clear with challenges?
Yes, ma'am.
Now, this is not very common and known to all, but this is very important thing and very, though it is very less spoken out, but still I feel that it is very important that we all have to know about what are the ethical and legal issues. Comparatively, we see that not in India, but out of India, wherever the nurses are, they are expected to know all the ethical and legal issues. So this all data privacy, which we have, the data in the patient data in the AI, we have to maintain it with a complete confidentiality and protection. Whenever you are being taught in NABH or JCI, you are been always tell you have to maintain the patient confidentiality. Don't talk about the patient outside. Don't discuss about your patient care with someone else. So these all things are being very nicely, very rightly taken by a robot, except in case of any unauthorized access, if they are giving, then only the data can be breached out. Secondly, there is a proper accountability. Who has opened the system, when it was been opened, or there was any malfunction, was there any error which has occurred during this operating out. There are proper systems being raised out, there is a proper feedback being maintained out, the protocols are extremely well feeded so that any incident can be well managed by checking out this system. Then we can talk about the regulatory standards. Now, these standards, as a human, as we nurses, as a healthcare worker, everyone was having SOPs, protocols, and standards. So, similarly, AI and robots are also been having a, they have to comply to the healthcare regulation and the safety standard. Time to time, this has been updated and has to meet to the whatever legal and ethical guidelines are being placed out. So this overall ensures a safe and standardized use of technology. Any doubt about this? Clear to all?
Yes, ma'am. Yes, ma'am.
Okay. So now when we say future, future, future. Now future, earlier it, the AI, the robots were a future. What about what is the future going to be beyond this? So we are looking forward that the AI is going to have AI integrated robots where AI is nothing but artificial intelligence which will work on this robot. So instead of human, there will be a proper AI system who will be taking the decision making. Now the decision making is done by the surgeon. For example, in the picture which I had shown you, the surgeon is the one who is handling the hubs and putting the tabs. But in future, we are looking forward that the robot itself will start do a smarter decision making and do it on its own. They will analyze the data. They will check out what the patient is actually requiring and do all the personalized care in a predictive and precision way. The secondly, the remote care which can be would be done by the robots. We are looking forward the telemedicine which we are nowadays doing that can be combined with robots. So the places where these robots cannot be reached out can be easily consulted in a timely way, and people don't have to travel every now and then and get a proper accessible continuity towards their care. This will overall give us a smart clinical environment where the hospitals will be connected to IoT devices, automated workflows, and intelligent monitoring system. For here, I would like to mention out that last 15 to 16 days back, we had a surgery at Kokilaben Hospital where the surgeon was around 750 miles away, somewhere in US. He was there, and with the help of AI, that surgeon has performed the surgery for a patient who was in India in Kokilaben Hospital. So this is the future what we are looking forward, where the AI can help out improvement, giving a very professional operational efficiency towards the patient care. Any doubts about this?
No, ma'am.
No, ma'am.
So let's have a conclusion and a recap of everything. How technology is going to be a support tool. The robots are going to assist healthcare professionals. They are not going to replace. Again and again, I'm going. They cannot replace. No robots are designed to replace humans. They have been designed only to assist the healthcare professionals. So it helps in improving the efficiency, accuracy, and safety towards the clinical workflow. The human touch still remains important. As I am saying, key robots can do everything, but the patient care, the special nursing care, which we say is the empathy, ethical decision making, the patient interaction, that can never be automated. No one can replace that. So that is going to be essential. The clinicals, will remain the central point of towards the patient care and recovery. The critical decisions has to be made by the clinicians, though we are very plan in a future ready way that it has to be integrated with AI, so it can be a safer, it can be a faster and a more personalized way. Still humans will be there for the same. Now, overall, our hospitals for the future will be having a balance of advanced technology along with the human centered care. Thank you. Anyone has any doubts? We can have our doubt session.
Okay, thank you so much, ma'am, for the excellent webinar. And
Thank you.
I truly appreciate the knowledge and information you have shared with us. ओके
Thank
एंड
you.
यस एंड सभी काउंसलर्स से रिक्वेस्ट है, आप फिर भी इसके रिगार्डिंग अगर आपके कुछ डाउट्स होते हैं, कुछ क्वेश्चंस होते हैं, कुछ क्वेरीज होते हैं, आप अपने काउंसलर से कनेक्ट करिए। एंड हमारा ये वेबिनार लाइक एवरी मंथ होता है, आपको अपडेट मिलता है इसी तरह के इंफॉर्मेटिव वेबिनार्स। सो थैंक यू फॉर थैंक यू सो मच मैम फॉर द प्रीशियस टाइम। थैंक यू एवरीवन,
I'm
थैंक यू।
also happy that I was able to give out my knowledge sharing to the nurses because you all are the future of our future healthcare.
यस
So
ट्रू
all
मैम,
the
ट्रू।
best to all. Thank you so much.
थैंक
Thank
यू
you.
एवरीवन। स्टिल कोई डाउट्स क्वेरीज है, आप अपने काउंसलर से कनेक्ट कर लीजिए। थैंक यू सो मच।
Thank you. Thank you.
थैंक यू मैम।